What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you had to take a test for anything else, hopefully you have tested negative for that as well. If you did test positive for COVID or anything else, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues if it is COVID. It is time now for the Tuesday edition of the Virus Update for Tuesday, November 5th, 2024. If you're new to my channel, welcome to my channel. You just clicked on to where I give updates on all the viruses that can make us sick. COVID, flu, influenza, RSV, norovirus, measles, tuberculosis. You may see that's going to be the first thing we talk about today. COVID is still a thing. It never went away. And something else that is a thing, these other viruses that we had vaccines for and still do are becoming increasingly more common for some reason. It's very strange and it's very unusual to see some of these viruses spreading so much, but they are, because COVID can wreak havoc on our immune system. Some people did not get vaccinated, or some children did not get vaccinated for some of these viruses, but really, COVID itself is doing a lot of damage, and it's causing things to shift to the unusual. Long COVID, it's still a thing. It will remain a thing. It is very underreported, and everything I just mentioned is really not getting enough attention, which is why I have this place here on YouTube where I talk about this. I give you the latest COVID levels, wastewater, news, and a whole bunch of stuff to help keep you safe. If you're new to my channel, subscribe to my channel down below. Give this a thumbs up, hit the notification bell, share this video with anyone you know, and leave your comments down below. Tuberculosis. That's the first thing we're going to talk about today. Case confirmed at Elmhurst University. This is in Illinois. 2 more suspected school offering free TB tests. So there are 2 more that are suspected. Still waiting for test results on that. Of course, if I see anything on that, I will let you know. Whooping cough is the problem up in Washington State. 1,000 whooping cough cases have been reported so far in 2024, compared to 49 over the same period in 2023. 1,000 versus 49. That is a humongous increase, and it is very concerning. Let's go on to another virus. Measles cases in New Brunswick more than double in 3 days. Yes, the number of measles cases in New Brunswick, Canada, is now up to 12. So that's a problem that continues to get worse. And now take a look at this. There is now an area in the United States that is listed as very high for COVID wastewater viral activity level. Yeah, look at this. Montana is now listed at very high for COVID wastewater activity level, and then you do have some other places that are still listed at high. Nebraska, Minnesota, Wyoming's listed at high, Arkansas is listed at high, Maine is listed at high, and so on. But the point here is, it's the first time we've seen very high for any state listed in a long time. It says in that state there is currently 6 wastewater sites that are reporting. All right. Now let's take a look at something that Sarah Ann Willett posted on X. And if you don't follow this account, it's a great account to follow. Also, check out her website where she posts updates on COVID and other viruses. And in this case, she posted about wastewater. Illinois, South Carolina, Virginia have all started their transmission uphill for COVID. And you can see that here on the charts that she provided. Illinois, you can see it's the very early stages. And then when we switch this to South Carolina, very early stages. Also very early stages in Virginia as well. And you can see here, here's the page that you would see over on her website. So go check that out. One other virus note today in the news segment, and that is in the UK. New Mpox strain, clade 1b, spreads to household contacts. And 2 more cases of a new strain of the Mpox virus have been detected in London in household contacts of the first patient. So this is a situation that is starting to evolve more over in the UK at this time, something that is getting rather concerning to see more cases, and I think it's only a matter of time until this appears in the United States. If it hasn't already and we just did not even detect it, we will get an update on the UK's COVID levels again on Thursday. Taking a look now at what is going on with the latest air qualities in the United States, and you will see here that there are still our usual trouble spots. Not a lot of areas, but the West Coast is still bad. Some problem spots down in the Carolinas, so that's something we will have to keep an eye on. And with wildfires popping up at any given time in the Northeast and portions of the northern Mid-Atlantic, air qualities can be a problem with that as well. All right, I do have another place where you can follow me. That's over on X for Climate Data Report, and plus you can also follow me over on YouTube. Yes, I do have a YouTube channel where I talk about climate and weather stuff, mainly a weather forecast, and go check me out there. Hey, look at that. We passed 500 subscribers recently. Let's see if we can get that up to 1,000. I think we'll be able to. Everybody needs to know what's going on with the weather, so if you want to know what's going on, check that out. Today I talked about a significant flooding event that is likely to happen Wednesday in South Carolina and Georgia. I am really concerned. It's not getting a lot of attention, and it should be. So if you live in that area, go check that video out. All right, Philadelphia yesterday for EMS calls had 799, and that's just one below 800. It's a number we have seen before. Taking a live look in at Montgomery County, Pennsylvania, we do see that there are not a lot of calls, but there are some calls that are not good. And 15, I should correct myself, 15 is a good amount of calls. Medical alert, alarm, respiratory emergency, cardiac emergency again, diabetic emergency, stroke, cardiac emergency yet again, overdose, building fire, vehicle accident. You get it. There are calls out there. And Chester County, Pennsylvania does have here a call for a sick person, not once, not twice, but 3 times, and there is also a respiratory difficulty call. All right, continuing on with Pennsylvania, that's the EMS stuff. Let's talk about COVID, because this gets a little bit confusing, and I hope you will be able to see this, and if not, that's okay. As a matter of fact, we're just going to refresh this. It's been very confusing times with the Pennsylvania dashboard. So you're going to see several different things here. You're going to see a lot of counties in Pennsylvania for COVID right now on wastewater are at no change. But then you also see here listed in the 15-day trend, you have the red, which is large increase. You have orange, which is increase. You have this yellowish color, which is no change. You have decreased blue. Then you have a darker blue, which is large decrease. Then you have insufficient data. Well, we don't see large increase anywhere. We see decrease just in one place. We see no change in the majority. We do see insufficient data in western Pennsylvania. We also see increase and large increase show up. Here's the deal, though. When we take a look at this, and coming down here to Indiana County, it's saying, okay, 15-day trend, large increase. Then we come over here to the northern Westchester site, which is in Chester County, Pennsylvania. It is showing an orange increase. However, when I check out these charts, I'm seeing completely different things. That orange should actually be in the southern site, because when I click on the charts here, the southern site is where it is actually listed as a rise at this time. And I'm going to try and get this on here. I don't know if you'll be able to see it on the screen or not. And here's Chester County site number 2. So let's make this full screen. And now it doesn't look like you're going to be able to see this, because obviously my camera is blocking the view. But what I'm trying to get at here is, it's saying the 15-day trend, there's an increase. When I take a look at the chart, I am not physically seeing that increase, but I am seeing it at the southern site. And, well, don't get me started with Indiana County. It's even different there. It's saying large increase, yet I'm not seeing a large increase. And I did go into some of these other places that say no change, and some of them are actually showing a rise at this time. So it is really confusing. I'm trying to understand what's going on with it, why the colors are not matching what the charts are showing for 15 days. All right, moving on. Let's take a look at the Canada viral activity level. Let me refresh this. Perhaps we do have an update. And COVID-19 is back to moderate once again. Flu A is low. Flu B is not detected. RSV is moderate at this time. And taking a look at what's going on with Walgreens, and we are going to do several states here. National positivity trend is 14.1% for COVID. Prior week is 15.9%. Hey, that's down 1.8%. Good news. Total test, 4,190 versus 4,675. Testing did go down once again. Indiana's positivity rate this week is 13.6%. The prior week was 20%. That is down by 6.4%. Total test, 88 versus 95. So, testing down, positivity rate dropping. That is good news. North Carolina, same amount of testing and a rising positivity rate. That could mean maybe cases are starting to tick up. Maybe they're starting to turn the corner here. And if we zoom to soon, we can see, yes, there is an increase. 13.4% positivity rate versus 12.6%. That's a difference of up 0.8%. Total test, 261 versus 261. Arkansas this week reports a positivity rate of 5.3%. The prior week was 15.7%. That is down by 10.4%. Total test, 38 versus 51. Now let's go to a much bigger state. Texas, 8.9% positivity rate versus 11.4%. That is down by 2.5%. Total test, 661 versus 797. That is still a decrease and represents that your cases are likely still decreasing. Let's see, we cannot do Arizona. Oh, I'm sorry, we can't click on Arizona. Sometimes when they're that really light shade of green, you can't tell if it's a state that's listed in white, meaning not reporting, but here we go. Arizona, 24.1% versus 24.5%. Difference of down 0.4%. Total test, 137 versus 155. So still, at this point, good news for you. We cannot click on what's going on with Nevada, Oregon. Yeah, there's a lot of states we just cannot do in the West. Colorado we can do, though. And Colorado, you're starting to trend upward. 19.8% versus 19.5%. That's up by 0.2%. Total test, 19 versus 87. That should probably say 0.3, but maybe it's 0.2999 or something like that. And let's see, let's do one more state. How about Connecticut? What's going on there? Connecticut, the positivity rate is 28% versus 23.9%. That's up by 4.1%. Total tests, 25 versus 46. Testing is down a good bit there. You don't do much testing to begin with. All right, let's take a look at some wastewater scan data. And I have to show you something that I've been continuing to show, and that is norovirus. But first, COVID is listed at medium. Most recent update did have one of them wonky downward movements. We'll have to see if that means anything. RSV is low, influenza A, influenza B, HMPV is low. Take a look at this. Norovirus, on the new update yet again, continues to go up higher. This is just truly concerning at this point. And we can also see here that when we switch to the regions, and we're going to do that in the Midwest, COVID is still dropping at this point. RSV, influenza A, influenza B, HMPV, still low at this time. And norovirus, though a wonky movement at the end, is listed high for there as well. In the Northeast at this time, COVID is slowly starting to go up. Disregard that wonky movement. RSV, though low, is starting to go upward. That looks like a pretty big jump at the end. So that's suspect as well. Influenza A, influenza B, and HMPV all still low. Norovirus is starting to continue to rise at this time, which is not good. It's medium. There is a wonky movement there at the end. So hopefully maybe that'll get corrected and can start dropping soon. In the South, look at this. COVID continues to show signs of rising. RSV is rising. Influenza A may be starting to go back up again. Influenza B is low. All these still low. And HMPV is low. And norovirus at this time is high and starting to continue to rise. In the West Coast, we do see that COVID is medium. But take a look here. There is starting to be an upward trend despite this little wonky movement. RSV is low. Influenza A is low at this time. Influenza B is low. HMPV is low. And, well, norovirus is literally going straight up at this point. So not good to see norovirus going so high there. Alright, I wanted to show you New Jersey today, but for whatever reason, New Jersey keeps coming up with no data, and I honestly don't know why. Are they going to switch to a new dashboard? Is something going on? I don't know what the reason is. And when we take a look here, we can see there's been nothing since the 31st of October. So, New Jersey, I wish you would start reporting once again soon. New York State, cases continue to drop. 290 new cases reported. And when we take a look at what is going on with hospitalizations, 511 today versus last week at this time where they had, let's see, 578. So hospitalizations continue to drop as well. And while we're at it, you know what? Let's take a look at the hospital admissions for New York State and see what they're doing. And take a look at this. They're continuing to drop as well, which is some good news after they saw a brief bump upward back in the middle of October. So not seeing that seasonal rise, or not seeing that cold season rise just yet for COVID in New York State. Alrighty, folks, that does it for the Tuesday edition of the Virus Update. I believe we'll have another Virus Update again tomorrow. Stay tuned, though. I have a busy day tomorrow, and plus, I am busy with that other channel, so there may be some days we get missed down the line. If I can't fill a video, I think what I'm going to start doing, I hate to even say this, if I can't fill a video for this channel, I'm probably going to miss a few days here and there, which is okay. We'll just save it all for another day, and, you know, maybe we'll just do these videos like 5 days a week or something like that. While the other channel, you're going to see me every day doing those weather videos, because these weather disasters are equally just as bad. But hey, it is very important that we continue these updates. And of course, over on X, you know, COVID data report, or over on Blue Sky, which I believe it's under data report, type in COVID data report. I should come up either way. You're going to continue to see me posting day in, day out, anything and everything I find. But the difference is, if I can't find enough to fill a video here, there's just going to be a few missed days. Or if it just happens to be too much and I can't do both channels in one day because I'm busy or whatever the case is, you may see a missed day. But obviously, like always, you will see that posted on X. If it's going to be a day, there's no update here. Alright, if you enjoyed this video, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday evening. Thanks for watching. Take care. Bye-bye.